my name is Gunjan. I'm going to be your student nurse today. And first, before we start off anything else, I'm going to do 20 seconds of good hand hygiene. So, how are you doing today? You're doing okay? Okay, that's good. Oh, I'm doing good too. Thank you so much for asking. Yeah, it has been a pretty busy day today. Well, nothing that we can't handle. Okay. So, before we start, can I have your name and date of birth, please? Susan Grant, October 24th, 1968. Okay, I'm just going to verify that with your wristband. Perfect, it matches. And I also noticed you don't have an allergy band, but just to reconfirm, do you have any allergies, anything specific involving chlorhexidine, latex, or tape? No allergies. Okay, perfect. Just wanted to make sure because we will be using that today. And are you feeling any pain right now? No pain? Okay, great. So I'm here today to do a dressing change on your central venous access device, also called Cvad. Do you remember how they changed this dressing for you last time? No? Okay, no worries. Essentially, we have to change the dressing every 7 days as an infection precaution. This tube was placed by your doctor and is used for delivering long-term treatments, including medications, fluids, and nutrition. And just to describe what I'll be doing in the procedure today, I'll start off with removing your old dressing, assessing the site, cleaning up the area, and then applying the new dressing. And if you have any questions or concerns, please feel free to voice them to me. I'd be happy to answer. This procedure really should not be painful, and it is pretty quick, but you may feel a bit of tugging since the dressing can be a little sticky. Okay, so let's get started. I'm going to start and do 20 seconds of hand hygiene and put on a pair of clean gloves to clean the table first. So what'd you have for breakfast today, Mrs. Grant? Scrambled eggs and pancakes? What better way to start the day off than with pancakes, right? Especially the pancakes in this hospital, I've been hearing they're a fan favorite. Okay, so I'm going to grab my wipe now, and I'm going to wipe the table for 30 seconds. I'm going to make sure to cover every surface in both directions, along with the sides of the table. So, Mrs. Grant, do you have any family visiting you today? You do? Your daughter's coming after work? That's so nice. Where does she work? Oh, she's a high school teacher. That's amazing. My mom used to be a high school teacher as well, and she told me she really used to love it. Clean the sides. Okay. I'm going to take off my gloves. Do 20 seconds of hand hygiene, and we're going to wait for this table to dry for 2 minutes. So while that table dries, I'm going to start prepping my supplies, but before I open anything, I already have a mask on myself, and I'm going to ask you if you can put a clean mask as well before we start the procedure. So I have a clean mask for you. Are you okay with wearing this, ma'am? Yeah? Okay, great. I'm just going to explain why. It's because we don't want you or myself to mistakenly cough or sneeze onto the exposed Cvad site. Yes. And for the same reason, can I also ask you to move your head to the side as well? Yeah? Okay, thank you so much. Okay, 20 seconds of hand hygiene. Perfect. Now that the table is dry after 2 minutes, I'm going to open the Cvad kit using no-touch technique. I'll remove my sterile gloves, drop in my BioPatch in the kit, open up my disinfectant cap for later, and also open up the SorbaView as well. So I'm just going to put my material here. I'm going to leave this here for now. I'm going to open up my kit using no-touch technique. Perfect. And now I'm going to take these sterile gloves out of the kit and put them over here for later. I'm going to take my BioPatch and simply peel it open onto the kit. Perfect. And I'm going to take my disinfectant cap, peel that open for later. I'm going to put that to the side. And finally, the SorbaView dressing, I'm going to peel this just from the corner and open it up. Perfect. So now that we have all of the setup of the materials, I'm going to do 20 seconds of hand hygiene, and I'm going to get clean gloves, and we're going to take off your old dressing now. And again, this should not be painful, but let me know if you feel any discomfort. I'm going to pull your blanket and gown down now. Okay, I'm looking at the site, and the external length looks to be about 20 centimeters and matches the previous documentation. I'm just going to stabilize the catheter while taking off the dressing now. Make sure to take off all of the sides. Keep stabilizing carefully. And then I'm just going to stabilize this to pull the rest off. Okay, perfect. Now we can dispose of this. I'm looking at the exposed site now, and I don't see any signs or symptoms of any infection. There's no redness, swelling, or irritation, and I don't see any cracks or leaks in the tubing, and the catheter still looks to be about 20 centimeters. So I'm going to take off my gloves now and do hand hygiene for 20 seconds. Now I'm going to move on and put on my sterile gloves, and we're going to get you cleaned up. So I'm going to carefully only touch the outer 1 inch of my sterile glove packaging. I'm going to make sure it does not touch any part or any packaging of the other items on my table. I'm going to do my first glove. I'm going to do my second glove. I'm just going to roll the cuffs down. And this cuff is rolled in, so I'm going to just leave it there, but yes. I'm going to pick up the wrapping and discard it. And now that I have my sterile gloves on, I'm going to get you cleaned up. So, what I'm going to do first is I'm going to grab my gauze and chlorhexidine, and I'll use the gauze to hold up the connector, and I'm going to crack the chlorhexidine, and we're going to clean the site for 30 seconds over the 2-inch square area. And yes, it does feel at times a little cold. But we're going to crack it, and now I'm going to do this for 30 seconds. Clean. The 2-inch perimeter. For 30 seconds. Okay, perfect. And now I'm also going to clean up 3 times all the way to the top. Perfect. So now that we've cleaned that up, I'm going to let this dry for 30 seconds. And the next thing I'm going to do is I'm just going to grab the bio patch. We're going to apply that using the taco method and pinching only the blue side facing up. And then we're going to get the Sorbeview on. So it's dried for 30 seconds now. I have my bio patch here in the corner. I'm going to pick that up and with the taco and just paste that on. Okay, perfect. So now that I have the bio patch on, I'm going to make my J-loop, and we're going to apply the Soberview dressing on top. So let me grab the Soberview dressing. Have the dressing. I'm going to be peeling this side off. That to the side. I'm going to make my J-loop sort of like a stress loop. And we're just going to apply the dressing on. I'm going to center the bio patch. And now I can just peel back the rest of this. Okay, perfect. So now the sterile portion of the procedure is over. And we're going to get our hub guard now and add that second piece. So I'm just going to, again, add this piece. And to add it there. Peel back the second part. Perfect. And finally, I'm going to get this last piece of tape to further secure the tube. Perfect. Okay, so now that we have all of the Sorbaview, the hub guard, and the tape strips secured on the tubing, I'll finally dispose of this. I'm going to grab the tape strip to write my initials, date, and time on the strip. And I'm going to add that onto the side of the dressing. Perfect. I'll collect all of my trash now and throw that away. I'm also going to dispose of this as well. And the final thing that I would like to do is replace the disinfectant cap. So this is the disinfectant cap that we prepped earlier. I'm going to take this one off. And I'm replacing the disinfectant cap to keep the access site clean. I would clamp the tubing to make sure blood doesn't come out and air doesn't go in. And I would not normally say this to the patient, but I am verbalizing it here for the Osce. So the rest of my supplies are all disposed now. And looking at the catheter after the procedure, the length is still 20 centimeters, so it did not move. I'm going to take off my gloves and do 20 seconds of hand hygiene. I'll help you take your mask off now, ma'am, and you can face forward. I'll put your blanket and gown back on. So was that okay, Mrs. Grant? It was good? No pain or discomfort? Okay, amazing. So I'm going to keep your bed in the lowest position with the side rails up. Here's your call bell if you need anything, and if you have any other questions or concerns about the procedure, just let me know. Thank you so much, Mrs. Grant, and I will go ahead and do my documentation now. So I will document my initial, the date and the time, how the site did not show any signs or symptoms of infection, and there were no cracks or leaks in the tubing. The catheter length was observed to be 20 centimeters throughout the procedure, and that the patient tolerated the procedure well with no further questions or concerns. Now I'll do my last 20 seconds of hand hygiene and exit the room. Thank you so much.